Okay.
Alright, we're going to go over our monitoring machine and our different parameters. So you'll notice each wire is neatly wrapped around its own little hook here. So we'll go over them one by one. The first thing you want to do is turn your machine on. Your screen's going to light up and it's going to give you all of your different connections, and they're usually labeled ECG, ETCO2, BP, temp, so that you know what numbers you're looking at. While that's turning on, I'll go ahead and show you each wire. So this is your ECG wire. This is going to measure your electrical impulse and waves throughout your heart. These do need to go in specific places. So they're labeled on this set, but they're not labeled on every set. So just for a reminder, your smoke is going to go over fire. So black goes on the left arm and red goes on the left leg. And then white goes on the right, which means that the right arm needs to have your white lead. And then if you happen to have a machine that has a green lead, that goes on your right back leg. And you ideally will put them in the kind of thin piece of skin in the armpit area on each leg. And if you put a little alcohol on those, they're going to read a lot better. Without it, they're not going to have good contact. And then this is your SpO2 monitor. So this is monitoring your oxygen saturation in your blood. And there's a little red light that comes on. This is going to read best usually on the tongue, prepuce, between digits, vulva, or any other thin area of skin where you're able to put water or alcohol so that it has good contact. And the red sensor or the red light needs to be on the best side with visual to your veins. So on a tongue, you want to make sure that your red light is on the bottom of the tongue so that it has better contact with those vessels. And the next one is your blood pressure. So we've got our cord here, and you can attach any size cuff that you need. It just goes in the bottom here. And then whenever you're ready, you'll select your settings for your blood pressure cuff, because there are small and large settings. So you'll just tap anywhere in that BP box, and you can select if it's a small or a large cuff right here. Hit that X button, and when you're ready to start, you can hit that BP start button, and it'll start to inflate. If you need to stop for whatever reason, you can hit it again and it'll stop. And then when you're done with it, you just take that out. And then the next one is pretty self-explanatory. It's your thermometer, so your temperature. We normally have that wrapped up neatly on the end here. And it's just a long skinny probe that we either feed down the esophagus or we will do it through the rectum. And that normally shows up in the upper corner box here. And then the last one on our machine is the ETCO2 monitor. It's flashing red now because it doesn't have a connector in it. So we'll grab one of those. They're normally in the second drawer. And they only fit on here one way, so it's hard to mess it up. This end will connect to your trach tube, and this end will connect to your breathing circuit hose. And when you have it on properly, the light turns from red to green. Whenever you attach your little piece here, you do want to activate your sensor, because unless you don't, it'll stay in standby. So you'll click standby, click measure, and then your number should start popping up. We don't have it connected to a patient now, so the number's scarcely low. And then whenever you're done with that, you'll just pop this out. You'll clean this, and we'll use a damp gauze with alcohol to clean off the ends of all of our wires or any little blood drippings that's dripped onto our wires throughout the procedure. Turn this off and then wrap them nice and neatly back on their each individual hook here. You want to make sure you don't wrap any of these too tightly, because they can damage if you wrap them too tight. So you want them to be organized but still loose enough to where there's not too much tension on each of the wires. And for your CO2 monitor, just for reference on our little pieces here, there are different sizes for different animals, so you just want to make sure that you're selecting the right one. This one's for bigger patients, and the smaller one with the smaller little airway port here is for your smaller patients.